Good afternoon. Welcome to day 240 at the EMA office where we have the latest in the numbers. Chairman Mark Kern is with us today, and also Sam Behrman. You have the numbers from the health department.
The not so good numbers again. I feel like this past week we've been on a roller coaster, and the last couple of days we've just had higher and higher numbers each day. Luckily, we are a little lower than yesterday, but still much higher than where we would like to be. As of today, 125,042 St. Clair County residents have been tested, which is an increase of 868 from yesterday. We are at 10,276 positive test results, which is an increase of 142 from yesterday. And that does include both males and females from under the age of 10 up to their 80s. Today, our daily county positivity rate is 16.4%. We are at 114,766 negative test results. We are announcing no new additional deaths today, so that's great. We are at 229 with no new additions. For those who have completed the IDPH required 10-day isolation period, we are at 8,923. For state totals, 8,404,304 have been tested, with 487,987 positive test results, which is an increase of 10,196 from yesterday. And for deaths, the state is reporting 10,196, which is an increase of 42 from yesterday. For St. Clair County hospitalization numbers, currently we have 63 individuals that are admitted due to COVID-related reasons, and 8 of them are on ventilators. And regionally, we have 129 individuals that are admitted due to COVID-related reasons, and 17 of them are on ventilators. For our congregate living facilities that are currently or have previously been in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had any changes. Cedarhurst of Shiloh has 17 cases and no deaths, which is an increase of 1 case for that facility. And Mercy Rehab and Care in Swansea has 23 cases and no deaths, which is an addition of 1 case for that facility. We do have some testing coming up this week, Tuesday, November 10th, from 10 a.m. to 12 p.m. and from 1 p.m. to 3 p.m. at the Dupo Firehouse. If you need more detailed information, you can find it on both the Health Department page as well as the EMA Facebook page. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. Here are the zip code. This is the zip code report for today. These are the COVID positive changes in these particular St. Clair County zip codes. In 62201, up 2 to 319. 62203, up 2 to 303. 62204, up 4 to 191. 62205, up 4 to 272. 62206, up 4 to 567, 62207 up 4 to 305, 62208 up 7 to 605, 62220 up 9 to 751, 62221 up 15 today to 949, 62223 up 14 to 645, 62226 up 21 to 1,107, 62232 up 5 to 276, 62239 up 2 to 154, 62240 up 2 to 55, 62243 up 2 to 181, 62254 up 4 to 326, 62258 up 8 to 305, 62260 up 6 to 223, 62269 up 35 today to 379. 62269 is O'Fallon, and we're just looking at that number. They are now up 90 in O'Fallon in the last 3 days.
879, not 3, 879.
879, up 35. What did I say?
3.
I said 3?
You said 379.
379, 879, but 879 is a big number, but I think really O'Fallon's up 90 in the last 3 days. That's a significant increase. 62282 up 1 to 24, and 62285 up 2 to 195. When we look at the daily county positivity, it's 16.4% in St. Clair County, derived by the fact that we did 868 tests, but we've got 142 new COVID positives. That brings our 7-day rolling average to 11.5%. Regional positivity, as calculated by the state, has us at 12% today. Normally, St. Clair County is bringing up the lowest point. Today, we are the high at 19.4%. Bond County comes in at 15.9, Clinton at 8.6, Madison at 15.4, Monroe 19.2, Randolph at 12.0, and Washington at 18.8%. All those positivity rates way too high. COVID is spreading, certainly in the general community. Really, it's everywhere. We've got to wear these masks and try to get this number down.
Well, and you can see that by the zip code numbers that you just gave out, that it's everywhere in the county, and we got to work on that. Today is our question and answer day. Brian, Assistant Director of EMA, is here and has the questions.
Sam, we'll start with the health department questions. The first one says, why are schools still holding extracurricular activities when it increases the amount of people the kids are exposed to? Can we focus on keeping them in school right now with the same group of kids and teachers?
So those guidelines are passed down from IDPH as well as ISB, which is Illinois State Board of Educators. They are making the criteria and the guidance for local schools. If any schools have any questions about what that guidance is and how to interpret it, please feel free to call the health department. We are happy to help you decipher that guidance. But again, that is guidance that comes directly from ISB and from the state.
Well, and Sam, as we've said many times now, the school districts are in constant contact with the health department for any guidance. And I know that if that question would come up, that the health department would definitely entertain helping them.
Oh, absolutely. And we've had many questions about when school was starting up again. Students in the library, lunch hours, just general classroom questions. And yes, our staff has been happy and willing to field any questions that any schools have had.
Very good.
Okay, the next person says, I personally know someone whose spouse is in Willow Creek. At one point, you gave numbers for that facility, but retracted them. She was told that 2 workers had tested positive, so why would it be retracted when you have indicated it would include staff or residents? Just curious. Thanks for keeping us informed.
So the 2 that we had originally reported, it was an error in reporting from our end. Every day we have 3 individuals that work at the health department that call all of our long-term care and congregate living facilities within the county. And we get those updates on any new test results, positive or negative, and unfortunately if any deaths have occurred at that facility. So we make those phone calls every day. We have not received any more reports of any positive test results, which is why we have not added Willow Creek back to the list. You have to have 2 or more to be considered in outbreak status for long-term care facilities. And so we do make those phone calls every day. And if there were new positives, we would add them to our list.
Okay, thank you. The next one says, with contact tracing, where are the hotspots? Is it grocery shopping, big box stores, churches, bars, dining in a tent, or home gatherings?
So the bar graph that we put up, I believe it was Friday, Thursday or Friday that we put up for our contact tracing. That had the bar graph for exposures, and the top ones were healthcare, employment, I believe, schools, restaurants, and I'm trying to remember the other 4th one. Private gatherings. So those are all where they had previously been and potential exposures. But on the IDPH website, if you are looking for true outbreak data, that is listed on IDPH's website.
Okay. The next person asks about that bar graph. They said the bar graph showed that schools were the number 1 place for COVID exposures. Why are school cases still not publicly reported, thus handicapping parents who are attempting to make educational decisions for their children? And when will this change?
So the last update that we received was that IDPH was going to start announcing outbreaks at schools. They have not started doing that yet. So as soon as IDPH does start announcing those will be made available on either IDPH's website, and I'm not sure if we will post those on the daily statistics that we do, but they will be made available as soon as IDPH does take that first step. So we are waiting for them, and as soon as they do, we will follow.
The next one says, are there any plans by colleges or other facilities to begin testing wastewater for COVID-19?
I do know that they are doing that in bigger metropolitan areas. As far as St. Clair County or anywhere close to us, we are not aware that any testing of that nature is going to start or has been conducted in the past.
Okay. The next one says, have you had any instances of people either violating their isolation or people who were exposed and supposed to quarantine but not doing so?
So yes, we lovingly refer to them as our problem children. Most of the time when we have someone who has not been the best at following their isolation or quarantine, it's been because they just haven't grasped the entirety and how important it is to continue their isolation if they are the ones they are positive, or if it's a quarantine because they've been exposed to someone. We do have other routes that we can go if someone does break quarantine and isolation. We have routes that we can go with our local state's attorney. Luckily, we have not had to go that far. Most people, once we have been made aware that they are perhaps breaking their quarantine or isolation, we've let them know that that's not a good idea, and we've spoken to them, and that's been enough to bring them back in and to let them finish up their quarantine or isolation at home.
Well, it's important to notice that it's really important to follow that quarantine, because there has been documented cases where people have broken their quarantine and have caused more problems.
Yes.
As recently, I think, in another state close by.
Yes, and I think, at least the situations we've had when we, have to give some tough love to those individuals, it's just that light bulb hasn't clicked, and most of the time once we give them that tough love, it seems like, okay, we get it. And it's not forever. It's either a 10-day period or a 14-day period. So once they get that, we've been able to move forward.
Good.
Okay, the next one says, if one were to contract COVID and be sick enough to need hospital care, is there a way to know which hospitals have access to the drug remdesivir? And thank you for your service you provide to the community. I check the site daily.
Oh, well, thank you very much. As far as the remdesivir allocations to each hospital, we are not made aware of how much remdesivir they have at the moment. So that might be a question that you could call your local hospital about. I don't know that they would give you that answer, but it's not something that we have information on.
But our local hospitals have had
Correct.
it.
They have received shipments and allocations in the past, and I'm sure will continue to as long as it's available from the state.
The next person says, in the bar graph that showed potential exposures, could one case be put into multiple columns? If I'm positive and went to a restaurant, school, and work, could I count as a tally in each category?
The answer to that is yes, especially if you are unaware if you came into contact with someone. Some of our cases we're able to say, yes, I was somewhere with this person and they were the ones that were positive. So we're able to focus that with that contact tracing. Unfortunately, sometimes there are situations where someone has been to 3 locations and they didn't know anyone that was there, so they were unaware that anyone was positive. So it is possible for one person to be in multiple columns in that exposure bar graph.
Okay. And the last person asks, we have been encouraged to get tested even if we don't have symptoms or a known exposure. However, we have also been told that just because we are negative one day, we could be positive the next. How often should we get tested?
So I don't think there's a number that I can put on that question, other than saying I think you have to look at your own personal situation. Are you someone who perhaps doesn't leave your house very much? Maybe you are leaving only for the essential items, grocery store, pharmacy, or are you someone who is leaving your house every day to go to work and you have kids? I think each one of those situations is individually different, and you have to look at your lifestyle to know if the more you're exposed to, the more potential you have to potentially be positive. So I think you need to look at how busy you are, how many times you're going out, and then take that into consideration when deciding how many times to be tested.
And I think a lot of people look at the risk level to those that they interact with. So if they're taking care of someone who may be immune compromised, and they still have to go out and work every day or get out and be in the general public, I think that it has been proven, certainly we talk about it every day, that you can be asymptomatic and still transmit this virus. So we would just encourage people that if you have an inkling that you might have been exposed, if you have symptoms, if you don't feel well, certainly quarantine, but if it's at a point where you need to get out and find out, you should get tested. I mean, I don't think there is any downside to getting tested. It's free, it's available. We've got these, we run these clinics several times a week, and we encourage people to get out there because we gotta isolate the virus. It obviously, 142 people found out that they had COVID. I don't know what percentage knew that they had it, but certainly there was a number of those people that didn't know, and they might have been out there spreading, and because they found out, they're able to quarantine and not spread the virus and help us to contain it.
And remember, we've talked about this before, but outside of the testing sites that we announced on the EMA briefing, there are some locations that are doing testing every day. So it's not just certain days. MedExpress in Swansea is testing CVS in Swansea and Belleville, as well as JJK, Jackie Joyner Kersey. Jackie Joyner Kersey, I know, is 7 days a week from 8 a.m. to 4 p.m. So if none of the testing sites, dates and times that work for you that we announced, there's always those options to fall back on.
Walgreens in Cahokia.
And Walgreens in Cahokia, yes.
And you can always call the health department and ask if you know that it slips your mind, because sometimes you get in a stressful situation where you need to get a test and you need to find out the best place to go, and the health department is a good number.
Yes, and if anyone has any questions about, where can I go? I have a child. Some places don't take children under a certain age. Please feel free to reach out and call us at the health department. We're happy to go through your specific situation with you and get you directed in the right testing facility.
Thank you. Chairman Kern, a few questions that came in here for you. The first one says, with cases creeping up, will there be additional mitigations?
So I would think that as these numbers continue to climb, we may find ourselves, as other regions of the state have found themselves, with additional mitigations. Those really are decreasing the gathering sizes with outdoor dining and those certain types of events. That's the mitigation they're putting on now. But I really think we need to be focusing on those who aren't following the mitigations that are currently in place, because they're the ones that are going to cause us to have additional mitigations. And how fair is that a business who are following all the rules, making sure they're doing all the right things, that they're going to be punished for the numbers going up because someone else wasn't following the mitigations. It really is frustrating when we find out that there are those trying to cheat the system, and they're the ones that are causing this problem. We've got a spread going on. There is no denying. You look at the numbers today, a daily county positivity of 16.4%. We haven't seen numbers this high perhaps throughout this entire pandemic. I mean, we have to go back to the springtime to find out, or to find numbers that are similar to what we're seeing now. That is very disturbing and something that we've got to get a hold on, because as of now, we really only see a rise in these numbers. We haven't seen any kind of a leveling off.
The next one says, how are zip codes showing increases 2 to 3 times larger than increase in positive test results? I realize there's a delay, but zip code numbers don't come close to matching on any day. Is this because antibody tests are now being reported as positive by Red Cross and other labs? I saw this on the Chicago News where that recently changed.
So, we, from the outset, today's 240, we report our numbers in St. Clair County, and at the end of the report, we report the state's numbers. They are 3 or 4 days behind on the zip codes, but all of these numbers eventually match up. Our numbers that we report and their numbers match up. There is a consistency. There are names and addresses tied to each person. It's true, the state did a dump about 3 days ago of tests that they considered probable and not positive. We had always assumed them positive. And so our testing and the way that we reported it, we were always doing it that way. The state just came around to our way of thinking. So our numbers, as we say every day, we think they're the most accurate because we put them together at 2:30 in the afternoon. We know they're there. We know what they are. The zip code report comes around, and eventually we see those numbers being fairly close to what we have in the county.
Okay. The next person says, will Herb be fired?
So here we are at day 240. We see our numbers rising a little bit, but we also see that we have managed to be able to take our numbers down from very high levels to really lower levels that we enjoyed just a month ago, and really in an area of the state where we're very close to St. Louis. We have a lot of things working against us, but we've been able to hold these numbers down. And I think a big part of it is because of this live feed that occurs every day, 240 days. Mr. Simmons has been here at least 235 of those days, if not more, and certainly it's his fingerprints that are on the template that put all of this together. This information that we put out was because there weren't any sources that anyone could really go to point to St. Clair County specific facts on COVID. And Mr. Simmons is the one that put this together. Now, when you talk about the job that he's done with COVID, that's not the only thing that he does for this county. He runs the emergency management agency, certainly was in charge of coordinating and putting out all of the PPE for the county. Hundreds of thousands of items have gone out of this building, have gone to hospitals and nursing homes, police departments, fire departments. He also runs the dispatch center, 911. He's in charge of all of that. Make sure that there's a lot of other calls that are going on in this county and have for the past 240 days. Although we have been consumed with COVID, Mr. Simmons has to be able to look globally and see a lot of other things. He sits on the boards of East-West Gateway Coordinating Council, the Bi-State Commissioners, which is in charge of public transportation for the region. He's chairman of the Swim Pack Agency. All of these are funders for infrastructure. All these things go on beyond COVID-19. And so what I would say is Mr. Simmons does a heck of a great job, and we're very lucky to have him.
Okay. The next person says, I would like a summary of what actions are being taken against restaurants not following guidelines. Even Denny's is open for dine-in. Stores are not enforcing masks. What is being done? We were told that local leadership should be taking control, but I don't see that happening.
So enforcement is an issue, and it really starts with that executive order. So the executive order says that with 2 warnings, action can be taken against a business that is not complying with the recommendations of the executive order. 2 warnings, and then a misdemeanor action can be filed against those particular businesses. So we'll just use a business in general, a restaurant in general. The only thing that St. Clair County can do would be to go out and give warnings, perhaps give a warning ticket, and maybe the food license of that institution might be at jeopardy. But if they're not following the rules of the executive order, if they're not requiring people to wear masks, if they're not requiring a lot of the mitigations, if they're not washing their hands, those are all things that they probably don't care if they have a food license or not. But we're still out trying to mitigate that. When it comes to liquor establishments, the St. Clair County office that I'm in charge of is only in charge of liquor licenses for unincorporated St. Clair County. The liquor license really is the main enforcement tool, I believe, that the state thinks is available to use to encourage bars and restaurants to comply. And putting their liquor license in jeopardy is something that a business owner will not do because getting a liquor license back is a difficult thing to do should they lose it. Unfortunately, as liquor commissioner of the county, I'm in charge of the outer county area. We have taken action in the outer county area, but we're really relying a lot on the state police they're the ones who drive around and they see these things. We also rely on you to inform us every day, and you do, with emails telling us places that you've been, things that you've seen, so that we can send the health department out, we can send the sheriff's department out to issue citations, but perhaps just to counsel people and say, can you explain why this person saw this at a particular time? We've got to pull together on this. If people are going to cheat, they're going to try to cheat, and they do cheat, it's going to cause our numbers to continue to rise. We've got to get a hold of the numbers so all our businesses can be open, so we can get to a point where we don't have to worry about new mitigations. What we have to worry about is, when are we going to open up a little further? That's the place I'd like to go back to when our numbers are so low that we're able to advocate to the Illinois Department of Public Health that we should be more wide open than what we are. Right now, with a positivity rate of 16.4% in the county, above the state average, it's very difficult to be able to advocate to the Illinois Department of Public Health that we shouldn't be where we are in the mitigation phase.
Okay, next question says, if the numbers now include positives and probable cases, we are never going to get out of tier 1 and back down under 6.5. Don't we need to change the rule of being under 6.5 for 3 days? How can metrics change on one side but not the other?
Well, as I said, we got to get these numbers down. It doesn't do us much good to be talking about whether it should be 8% or 6.5% when we're at 16.7%, rolling average of 11.5%. Let's drive those numbers down. Let's get in compliance in places that aren't in compliance, and then we can start talking about how to advocate with the Illinois Department of Public Health to let us reopen, to let us get back to where we were before.
And I think something for clarification, Sam, if you can probably tune in on this best. When we talk about these probable cases, what we're talking about is someone that does have a confirmed positive, but it was on a rapid test.
That's correct.
That the state is now saying, yeah, we need to count those. We've counted them all along here in St. Clair County because it was a confirmed positive on a test.
That's correct.
It's not just assuming someone was around COVID, so we're calling them probable. There is a positive test that goes with that. The state has just labeled it a probable.
That's correct. So when we talk about someone that is probable, it's not just because, as Brian said, they were exposed to someone or they are having COVID-like symptoms. This does include a positive test result with a rapid test.
It was just the type of test that caused the state to classify it differently.
Correct.
That at the time, they I guess, weren't sure about the rapid test, so they classified that as a probable, even though we classified it as a positive. It showed up as a positive on the test itself. Now they've come around to say it really isn't probable. When you get a rapid test and you're positive, you're not probable, you're probably positive.
And what the state was doing previously was, if you did get a positive on a rapid, they may have suggested that you go for a different type of test called the PCR to confirm that. So now they are saying that that's not an issue, and we can just take that rapid test as a positive.
Thank you. We'll go to Director Simmons for one more question that came in. It says, what is going on in the stores? I had to go and they were literally out of everything, but the lines were long and a huge number of people were shopping. More than I've seen in stores since this whole thing has began. Some didn't even have masks on. It was scary. Is it because stores are running special Black Friday ads, or what's going on?
Well, it could be a variety of things. It could be sales with the holidays coming on, the mask not being worn, is just what the chairman is talking about. Some places are enforcing it, some aren't. We get calls every day of both. The stores are adhering to the mitigation, but unfortunately we're getting a lot more now recently of people saying that they were in a certain store and they wasn't. But what I'd like to say is, now's the time. We got to all focus and stay calm. We got to get these numbers down, and we can only do that by everybody coming to the realization that this virus is here, and it's going to be here. We say this each and every day for 240 days. The light switch isn't going to go off. We have let our foot up off of the gas here in St. Clair County. Team St. Clair, for those of you who follow the briefing every day, as I say every day, I know yous are out there spreading the word, telling friends, families, and neighbors. Those who aren't, you got to understand this is serious. Otherwise, as I said yesterday, these numbers are going to get higher, and then it's going to take us a lot longer to get back down to where we need to be. As the chairman said, we cannot advocate anything for us individually or for our businesses. Each and every one of us owe it to everybody else to do our share to help our businesses out. Our businesses, I get emails, I get text messages every day from business owners saying, what can we do? We've had the Chamber of Commerce, Wendy has been in here with us. She's been spreading the word. They are trying to do their best, and now we have to support that. Let's just everybody buckle down for a little while longer, and let's get these numbers back down to where we can manage them. Right now, they're not being managed. I mean, regionally, we're up to 12 today. Projected to go up a couple more tomorrow, maybe. So we've got to get the numbers back going in the right direction. We appreciate each and every one of you sending in those questions. We try to answer as many as we can. If we didn't get yours answered, we'll try to do it later on this evening. We're going to be back momentarily with Cindy to get this translated into our Spanish communities, and then we'll be back tomorrow for 241 days of bringing you these numbers. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside.
Buenas tardes, hoy tuvimos a Sam Bierman del Departamento de Salud que nos informó los nuevos casos del condado, que son 125,042 personas examinadas, 10,276 casos positivos con aumento de 142 nuevos casos, hombres y mujeres entre la edad de 10 a 80 años, 114,766 casos negativos, 229 muertes y 8,923 personas han completado la cuarentena de 10 días requerida por el Departamento de Salud. Los números estatales son 8,404,304 personas examinadas, 487,987 casos positivos con aumento de 10,196 nuevos casos de ayer. Y hay 10,196 muertes con 42 nuevas muertes de ayer. Y de estos casos positivos hay 63 personas hospitalizadas en el condado de St. Clair County y 8 ventiladores. Y en la región tenemos a 129 hospitalizados y 17 en ventiladores. Y en las clínicas a plazo largo hubo cambios en Cedarhurst of Shiloh con un nuevo caso y Mercy Rehab en Care Center con un nuevo caso. Y Mark Hearn nos dio los códigos postales con casos positivos que son 62201, 319 casos con aumento de 2 casos de ayer, 62203, 303 casos con aumento de 2 casos, 62204, 191 casos con aumento de 4 casos, 62205, 272 casos con aumento de 4 casos, 62206, 567 casos con aumento de 4 casos de ayer, 62207, 305 casos con aumento de 4 casos, 62208, 605 casos con aumento de 7 casos, 62220, 751 casos con aumento de 9 casos, 62221, 949 casos con aumento de 15 casos, 62223, 645 casos con aumento de 14 casos, 62226, 1107 casos con aumento de 21 casos, 62232, 276 casos con aumento de 5 casos, 62239, 154 casos con aumento de 2 casos, 62240, 55 casos con aumento de 2 casos de ayer, 62243, 181 casos con aumento de 2 casos, 62254, 326 casos con aumento de 4 casos, 62258, 305 casos con aumento de 8 casos, 62260, 223 casos con aumento de 6 casos, 62269, 879 casos con aumento de 35 casos, 62282, 24 casos con aumento de 1 caso, 62285, 195 casos con aumento de 2 casos. Y en la región 4 estamos al 12%. Y hoy tuvimos una sesión de preguntas que fueron a... Las primeras preguntas, Sam Bierman del Departamento de Salud fue si están recomendando que nos examinemos si no tenemos síntomas. Y la respuesta es que sí, porque unas personas no tienen síntomas y así prevenimos el contagio. La segunda pregunta fue ¿por qué las escuelas no son requeridas reportar los casos positivos? Y la respuesta es que cada distrito tiene sus propias reglas. Y una de las preguntas a Mark Hearn fue que con los aumentos de casos positivos, ¿sí tendremos nuevas restricciones? La respuesta es que sí, lo habrá, nos avisará el gobernador de las nuevas restricciones. Otra pregunta fue, ¿qué consecuencias tienen los restaurantes y barras que no estén siguiendo la orden ejecutiva? Y la respuesta es que las autoridades locales se encargan de multar a esos negocios. Y finalmente, Hersman nos recomienda que sigamos usando el cubrebocas.